NHS hospitals have been at the very heart of the fight against COVID-19. An unprecedented effort to mobilise staff and reorganise services has meant that the fears of being overwhelmed never materialised. But still, what is it like being there? Last week, our health correspondent Gill Dummigan spent 3 days at the Royal Blackburn. In the first of 5 exclusive reports, she looks at critical care.
People can't begin to comprehend what it's like going through this.
We're not used to seeing 50% of our patients not survive, and that is the data, is that 50% of patients who are admitted to a critical care unit with COVID unfortunately do not survive.
In all my time on critical care as a nurse, I have never experienced anything like this, ever experienced anything like this. So it's awful.
Consultant Ian Stanley is preparing for a ward round in the COVID critical care unit.
Even though it's something we've done quite a lot now, it's still that thing you think, am I doing it right? Am I doing it in the right order? Have I missed something? Does my mask fit properly? Have I got any leaks? It's just that constantly reminding yourself of, or checking with yourself, am I doing it properly? Am I doing it properly? Am I doing it properly?
The unit is for the sickest patients who can't breathe without an oxygen supply.
We have some patients in the very early phases of disease who we are delivering CPAP to, which is basically a form of driving oxygen into their lungs and into their blood by applying almost like a space hood or a tight-fitting mask. We have some other patients who are sedated and have got breathing tubes into their windpipes and are attached to ventilators. They seem to be responding quite well. We have some patients who have been on the unit for 45, 50 days.
Since the beginning of this crisis, the number of critical care beds in the hospital has doubled. 8 weeks ago, this was a cardiology ward. It's been turned into a critical care unit to deal with the sheer number of people needing this specialist intervention. But when the virus gets to this stage, the damage it inflicts can be beyond any treatment.
The suffering we see, obviously for the patients, obviously we're used to death working on critical care, but I've seen deaths which have been rapid. We're unable to get families here, we're having to use iPads. I can't put words on it, I don't think I'll ever experience it again.
The ventilation used on the patients also increases the risk of contagion for those treating them, who have to use the highest level of personal protective equipment, PPE.
They come in here and use a buddy system to make sure that the PPE is put on adequately. That means that the mask is fitted absolutely perfectly, so there's no leaks, that the gown's tied properly, the hair is all put up in a theatre cap. They've got gloves on, which doesn't expose any skin, and then on the top of that they put a visor or some goggles so that they've got eye protection.
Although it's essential, PPE makes life here even harder.
PPE is extremely unpleasant. It gets very hot, it cuts into your face.
So even now when I'm talking to you, I start to feel a little short of breath because of the mask. So I can't carry on very long conversations. So someone who's awake, it's harder to communicate, it's harder for them to hear you.
And you find that once you put your mask on, your brain does go into panic mode just for a few seconds, and you've got to really tell yourself to slow your breathing down. A lot of people have to mouth breathe, so the one thing that my nurses really want when they come out after 4 hours is fizzy drinks and something cold.
Nurses work a 12-hour shift, split into 3. For the breaks in between, the hospital has turned this room into a rest area.
So we just come in here when we come off the unit, is somewhere away that we can just have a drink and something to eat. We tend to talk about absolute rubbish that's nothing to do with work in here because it helps us to take our mind off a bit.
The work here is unremitting, the endless hope that patients will become well enough to leave.
You always want the best for people, you always want them to pick up, even though they're in intensive care, you always hope that they will come out the better side.
Hi, Alex. Alex spent 3 days in critical care. When we met him, he was out and on a general COVID ward.
I feel better myself. You feel as though you're getting somewhere, you know, instead of just rusticating in a corner. People are very nice. The nurses, you know.
But Alec is still very weak.
Very difficult to explain, really. You feel in your mind because you've done all these things before, oh yeah, I'll get up and do that. And we can't. You just simply can't.
Later that day, Alec's condition deteriorated. He's now back in ICU. As the country adapts to a new normal, staff here still contemplate a long and tough journey.
The new normal for us on intensive care is going to be having the capacity to deal with a certain number of COVID patients until there's a vaccine that's effective, so that we can almost eliminate the disease in the community. We will always see people coming through, and unfortunately there will always be a proportion of those patients who require critical care.
Gill Dummigan, BBC North West Tonight, Blackburn.